Hello guys, so this is the first lecture of the cardiovascular system, and this chapter is going to be described about the basic blood vessels which are considered to be the extra cardiovascular system, or that cardiovascular system which function peripherally. So why it is important to talk about this system? Because blood vessel and the other capillary network, they changes time to time with respect to any pathology or physiological changes which is encountered by the heart or cardiovascular system. So, therefore, we do not say that you have a problem with the heart. We always refer that there are some issue with the cardiovascular system, because cardiac and vascular system are considered to be work as same as the other system of the body work. So basically, the blood vessels, which I am going to explain right now, have three important component, or it have three major layers. So the inside one, the most insidious layer, it is called intima. It is a Latin word for the inside. The second, the middle layer, is called the media, and the outer one is called adventitia. So these three layers are the basic physiological layer of your blood vessel, which can be both artery or the vein. Capillary have also the layer, but it have two majorly, intima and the adventitia. Capillary don't usually have media, but there are some exception for the big capillary system. Now coming to the in-depth review about this blood vascular system. Why am I going to discuss about this? Because we have a condition called atherosclerosis. This is the most common condition which we are going to discuss in the further episodes. So I'm going to take a pause, and I'm coming back to the major topic, the three layer of the blood vessel. So the intima, the innermost layer, which constitutes the endothelial cell, which is responsible to selective permeability, means it selectively allows ions and cations to move inside or outside this cell wall. So there are ions for the potassium, sodium, which selectively permeable to this endothelial cell. That is how they change the physiological state of these blood vessel. Now, this selective permeability, if get hampered, that result in a capillary leak. And again, it constitute the major dysfunction of the cardiovascular system. So again, I'm going to repeat that our blood vessel have three layers. From inside to out, it is called intima. The middle one is called media, and the outer one is called adventitia. Now, Coming on the middle part, the media. Now, media is the major hero of our story because this is the place where the atherosclerosis start. Means the endothelial lining of this layer gets hampered and result in the atherosclerosis. Now, how does atherosclerosis start? If I take an example, a classical example, this is the normal tunica media. Now, there is a change in the single layer of this media and there is a collection of plaque. Now, what happens when the blood flow like this? It usually go in the straight part. But if there is a collection of endothelial cell in the tunica media because of abnormal cell cycle or the lipid protein which are going to be freely moved inside the blood, they get collected in this pattern in the form of a patch. Now, the blood which is going to be flowed in a straight streamlined fashion gets deviated and make a change in the path. So, the blood which is flowing, let's say 5 meter per second, gets a delay in its speed, and as it fall down to a speed breaker like a condition, it increases. So there is a fluctuation of the speed of the blood flow which result in the delay in the availability on the particular site which is going to be needed. As the disease progresses, there is more marked fluctuation in this blood speed and there is a reverberatory blood flow or the reverse momentum of the blood flow. It again create a pressure over this tunica media and this epithelial slab get dislodged. Now there is one more concept for thrombosis which is going to be covered in the brain section. I'm going to explain later in this how the thrombosis form, how it is going to be affected in the central nervous system. Now coming to the outermost part, the adventitia, it have a fibroblastic cell population which contain the nerve ending. You heard it right, the nerve ending. So this system is going to be responsible to change for fight or flight response. So as a flight or a fight response, it again create vasoconstriction or vasodilation of the peripheral nerve. Now, the importance of this system is going to be described in the form of some disease. This endothelial function has some effect and some physiological property. Now, the good response of this endothelial cell is first vasodilation, antithrombotic activity, anti-inflammatory activity, and antioxidant properties. Again, the internal layer is responsible to withstand oxidative stresses which are due to free radical of the oxygen ions or cations which freely moves inside the blood. Now, the negative effect of these endothelial cell is impaired dilation. Means the dilation won't hamper, the dilation won't occur. Prothrombosity is the next effect of this impaired of the endothelial cell, and it create pro-inflammatory marker such as TNF alpha, and it creates some pro-oxidants which again affect your blood flow or abnormal overloading of the diastolic component of heart musculature. So, to begin with the cardiovascular system, it is very important to understand the basic unit, how it is function, how the peripheral vessel works, and what effect would occur if there is any inflammatory or disease to that particular system. I hope you like the video. Please keep following us and give a like.